Okay, we're going to get started. It's 10:05, and I know Manuel Hyman has to leave early. But first of all, I want to thank everyone for joining us on our first virtual resource fair. My name's Deneen Hinton. As most of you all know, I'm a community education specialist here at Alliance Health. Part of my job is to participate in community health fairs, but as you know, that's not an option right now to be out in the community. So we try something different. We're doing something new. We're doing it virtually. So thank you for coming again, taking out some time out of your schedules to participate and join us. We have a few folks today that I've asked to come to share resources. This is all about share resources, information, updates on how people are serving our community, our citizens of Durham during this pandemic. We've had to do things differently. Business is not as usual. So I appreciate the folks that are going to be speaking today, our presenters, coming and sharing with us. With that said, I do have most of you all might have noticed Brandon Alexander is on as well, and he's going to be helping me with the challenges of Zoom, and I really appreciate him for doing that. So first, we have Manuel Hyman, who's going to talk to us today about housing. He is our ILI housing coordinator in Durham. So we're going to hand it over to Manuel to see what he has to say. Thank you, Manuel.
Thank you, Deneen. Do y'all hear me? Do you hear me? Miss B, I see you nodding your head.
Yes.
Very good, very good. All right, thank y'all, everybody. I am so glad to be a participant in this activity today. So we're going to update you with ILI information, Independent Living Initiative. Most of you, a lot of you you've already been trained in ILI. You know about ILI. You may not be aware of the of any updates or any changes, and you may have recently taken a training. But we'll go through this real quickly, though. Next, Brandon. Very good, Brandon. You are great. So what is ILI? ILI is a one-time, short-term rental housing assistance program for individuals with mental health, intellectual developmental disabilities, and substance use diagnoses, and who are working with a contracted alliance provider, and for those who are homeless or at risk for becoming homeless. Next. And eligibility, the member has to be actively involved or engaged in services with a provider contracted with Alliance. So they have to be part of our provider network, and they must be a resident of our catchment area, Cumberland, Durham, Johnston, or Wake counties. And by the way, I am the ILI coordinator for Durham and Johnston counties. So just put a pin in that for yourselves. Income has to be at or below 60% of the area median income. The household must be experiencing or have experienced a recent crisis, and we'll talk about that briefly in just a moment. They have no other options to prevent homelessness, so we are typically a last resort, and the household must be able to reasonably sustain permanent housing once funding ends, and the household, someone in the household must have Medicaid or be uninsured. Next. So, continuing with eligibility, during this health crisis that we're in, COVID-19, members must be actively engaged in any therapeutic service, because at one time, well, prior to the to this event, ILI, in order to meet criteria, folks have to be engaged or had to be engaged in enhanced services. So now, since we have relaxed our criteria and requirements, any service level is taken into consideration for ILI funds. Again, we've relaxed our criteria and procedures in order to meet the needs of our members until further notice. So this will not be an ongoing thing unless we decide that this is how it's going to be after we get through this crisis. And documents and information remain necessary components of the application. And contact me if you have any questions. But the documents and information, there can't be any workarounds, providers. We cannot have workarounds. ILI requires certain documents, certain information. And so, you know, and some providers will contact me or leave out information and don't understand why, you know, when an application is denied, you know, there might be some, you know, some feedback about that, but we do require certain documents and information. And so workarounds will not be entertained. So, so keep your workarounds to yourself. Okay, next. Wow, blank. Go to something else, Brandon. Let's see what's going on. Oh yeah, keep going. Yeah, keep going. We're going to talk about, that's good. Barriers to housing for our members are income, because a lot of our members rely on SSI benefits. And so, and going to the availability of affordable housing, there is no such thing, especially for our members, because they can only afford what their income can afford them. Education, mental health, and disability status, criminal background, credit history, and eviction history. These are things that the landlord or property manager, they have access to this information. And so they can create their own barriers for that household, so that for that member, so they're unable to access that property, to live in that property. And so, and also we ask that, I get a lot of phone calls from members and from providers. Do we maintain a list of properties that address these circumstances, these three circumstances highlighted in red? And we do not. And it's the responsibility of the member and the provider to locate housing that fits the member's circumstance. Okay. Transportation and residency status are also barriers. Next, Brandon. ILI is for rent payments. Rental property only, no home ownership. So if a person is experiencing foreclosure, they need to contact North Carolina Housing Finance Agency for assistance. Next slide, please. ILI pays utility payments and deposits. And again, these need to be associated with rental property. So with fuel and heating, water, and electricity, that's what we do. Next slide, please. But we do not pay for cable. We do not pay for internet. We do not pay cell phone. So a crisis could be considered temporary loss of income, threat of eviction, loss of housing voucher. They just started a new job, although that's not a crisis, but that helps us to assist the household. The income will be coming into the household, okay? So we know that that's happening. We know that they'll be able to continue meeting their rental responsibilities and utility responsibilities because they will have an income after our funding ends. Overcrowding, the need to move. They are couch surfing. So they need to be out of the house and have their own lease, have their own property that they can rent. A traumatic life event could be a car accident, death in the immediate family, or inclement weather. So not considered a crisis will be car issues. And you're probably like, you know, a question mark, like, why? Well, if a person has a car, these things are added to their budget. Okay, the monthly car payment, the yearly or annual registration fees for the vehicle. If they have tickets, you know, don't speed and don't park in places where you shouldn't park. And repairs, that's part of owning a vehicle. You're going to have repairs and maintenance. Mismanagement of funds, playing bingo or playing the lottery and lending money you don't have. You had to pay other household bills. the things that take away from you paying your rent and utilities, a desire to move from one housing location to another. You're already stably housed, but you want to move somewhere else. We can't assist with that. Next slide, Brandon. So requests for ILI assistance only accepted online through the ILI system, okay? Online only. Next. Requirements of you, the service provider, attend the ILI housing training. Have honest conversations with the applicant. Offer no false hopes, no guarantees. Don't say that, you know, you'll get funded, you'll get the money. They may not. It's not guaranteed. Keep the member abreast of the ILI process and the application submission status. Provide detailed, brief summaries explaining the need for assistance and what precipitated the need, what caused the event, what caused the eviction, what caused homelessness, and advocate for the applicant, okay? Preventing exploitation and vulnerability by a landlord or property manager. And oftentimes, you know, landlords and property managers, they can see, or the member can provide too much information about their own health status, where that will cause them to become vulnerable and taken advantage of by a landlord or property manager who does not have their well-being, the member's well-being at heart. Also reasonable accommodation, you know, and fair housing. Knowing that information, knowing how to advocate for the member who may be experiencing some fair housing issues. Next, Brandon. Current service providers, current ILI trained providers, do not share your password with colleagues. We strive to maintain ILI system integrity and compliance and security. Instruct your colleagues who have fallen off the ILI grid, who haven't been trained, well, not trained, but who have not used the system in a while, and they might want to use your password, and they can get a password reset. They can get assistance with the system, with their account being locked out. They can get phone interventions, application assistance. They can get refresher training with the ILI system. Or if they're a new user, they're new to your organization even, if they want to access the system, they need to be trained. And training is for the individual staff provider and not for your organization. So you are not to submit applications on behalf of your colleague, okay? Each individual staff provider must be registered in the system and complete and submit an application for that member that they directly serve. All right, and let me say this while it's on my mind. The trainings, while we're working from home and all that, trainings for Durham, or anybody actually, are Wednesdays from 1 p.m. to 3:30 p.m. via free conference call. So if you are interested in today or future trainings on Wednesdays from 1 to 3:30, email me, let me know so I can get you signed up and get you ready to serve your members with ILI. Next, Brandon. So you can assist the applicant with housing choice, with selecting housing. And you may be familiar with these websites or these resources, socialserve.com and nchousingsearch.org. You'll create filters. For example, you'll choose Durham County, choose Durham City, and you'll see properties in Durham where, thank you so much, Brandon, for putting my email up. You'll see pictures of the property inside and out. You'll create more filters such as the number of rooms, number of bedrooms, number of bathrooms, things like that. So just play with it, tinker with it, and have a discussion with your member or the applicant about these properties. No subleasing allowed. Okay, so a person who was already leasing a property, they desire to have a roommate, I guess, so to speak, but they are creating their own lease agreement for that member. And so, no, that will not be allowed. Somebody already leasing the property and they want to lease a room or space in that leased property, no. But this does not include transitional housing like Oxford housing, or single room occupancy where a person owns a home and they're renting rooms in that home. Next, Brandon. As part of your sustainability plan in the ILI application, you can add that you're connecting the member, the household, to participate in Ready to Rent. I have been trained in that to facilitate this type of training and or providing this information to the head of the household or to the entire group. And you can have small groups in your organization where I can come and visit once we get to do that again. Or we can be creative and use this format or other online formats to have that type of training. And it can be tailored. You know, it doesn't have to be the whole Ready to Rent curriculum. It could be tailored to just highlight certain areas of Ready to Rent, such as it prepares the new tenant for rental housing or landlord-tenant relationship, neighbor relations, visitors and children, and creating a spending plan. Next slide, Brandon. And it's also for existing tenants, because many of our members and tenants, they move into property without having the benefit of some type of training or information on how to act in a household. And so, or when you have your own property, personal and household safety, eviction prevention, credit, finance, management, and also consider young people, young mothers, for example, young families embarking on independent living, and aged out foster care. Next, this is my contact information. And the third phone number is my mobile phone, and you can reach me there quickly and easily, and also my email address. And if you have any questions, I've got to go, so don't put them in the chat. Okay, explain again who qualifies for this service. Qualifying for the service, any of our members who are homeless or who are housed and they're experiencing eviction, they are eligible for rental assistance, financial rental assistance for eviction prevention or coming out of homelessness. And we help people with startup costs. I'm sorry, Denise, thank you. Startup costs, which include security deposits, first month's rent, and utility deposits, if applicable. We also have what's called Restoring Hope, which is a program under the umbrella of ILI, which is a longer term commitment, financial commitment for some members who fit those circumstances. But that's if a person, a member of that household has experienced or interactions with crisis centers, emergency departments, emergency shelters, jails, psychiatric facilities, 4 or more times during the past 12 months. And so again, if you, there is, Ms. Harris, there's financial assistance for boarding rooms, boarding houses. Yes. So from that last slide, we do that. Does this program help young working families who aren't ready to buy a home but want their own place? Is there a salary requirement for this? No, but there needs to be an income, because after funding ends, they need to be able to sustain housing once our funding ends, because funding is very short term. Is this information being recorded for future sharing? Deneen, is it?
That answer is correct. Yes, it is being recorded.
Okay. And again, you can, and I have to go very shortly, so you can contact me via email or phone. All right. And I appreciate you all so much. And y'all have a wonderful day, and stay safe Stay well. Thank you
Thank
again
you,
for hearing
Manuel.
me out.
Thank you,
Bye-bye.
Manuel. I really appreciate you.
You're well. I appreciate you too, Deneen and Brandon. Bye.
Bye. Yes, don't forget that you can email Manuel. There's probably a lot more questions that you may have that he can answer, but he had to go. So with that being said, we have 4 other folks that that are going to be joining us. I did not introduce them initially, but I want to do that now to make sure that you all stay around and listen to what they have to say, because they have good stuff to share, important information. So we have Jessica Stewart from Public Health that will be speaking to us. We have Miss Beatrice Laney, who will be speaking to us from Durham Public Schools. Really appreciate that. And Mr. Lee Little from Department of Social Services, Durham County Social Services, who will be speaking with us. And last but not least, Deborah Duncan from Durham Network of Care. And she is going to share what that's about, what Network of Care is about, and all the resources that are in the network of care. So you don't want to miss that. So I really appreciate all the panelists, and if anyone else at the end has some important resources and information you think the citizens of Durham and our consumers need to know, please put it in the chat, and we will give you an opportunity to share that. We don't want to miss anything, because like I said, this is new, this is different, but we may have to continue this for the next couple of months. So we want to make sure people are informed and getting what they need. Okay. So up next, we have Durham County Public Health representative that will be sharing how they are doing business now. They may have information about testing, how the consumers and the citizens of Durham are doing, and how they're providing those supports and services. So next
Good
up.
morning, Miss Hinton. Can you hear me? This
I
is
can
Jessica
hear you.
Stewart.
Thank you so much. Yes, I can hear
You
you.
are welcome. Thanks so much for involving us with this. We really appreciate the opportunity. I just, I know everyone's I'm working on the hotline, getting a lot of calls each day from the citizens, and the most frequent calls that we receive are they want to know, where can we get guidance? Where do we find out more information on COVID? What's the easiest place for us to go and get the access? And then the second question that we hear most frequently is, where can we go to get tested? So we're fielding a lot of those questions and connecting the citizens with resources and places that they can go to get tested, and places that they can go to get more information. Our Durham County COVID hotline number, I'll throw that out really quickly. It is on our website. It's 919-635-8150, and someone does answer that call 7 days a week right now. If the citizens have not been to our Durham County Public Health website, that is a wealth of information. There are frequently asked questions answered on there, and that website is decopublichealth.org. The thing that I find most helpful on there is citizens can go and sign up to receive daily emails. There's just a link to click on. They can put their email address in there and kind of tailor the information that they want sent to them on a daily basis, based on, do you want general public information? Do you want information as a healthcare provider? Do you want information as a business owner? And those email, of course, and you can also sign up for them to receive them in Spanish as well. And so you can sign up for more than one of those if you want general public as well as healthcare information. I get all of them sent to me on a daily basis, and that way, if anything changes in the county or with CDC guidelines, that comes straight to your inbox. So that's really useful. Another really useful website is durhamnc.gov. And what I found very useful on that website is there's been a little confusion with dates and so many executive order changes with the state and with the county. There's a really good chart on there that kind of simplifies what is in effect by date when you compare the state order versus the Durham County stay-at-home order. And so it's broken down in a very simplified manner, very user-friendly. And as far as where citizens can go to get tested, that also, some of that information is on our decopublichealth.org website as well. And we give out numbers. We first, suggest citizens reach out if they have a primary care physician. We always want them connecting with their primary care physician. There are other options if someone doesn't have a primary care physician, and we certainly can help them get connected and find places to go get tested, ways to go get tested. Different hotline numbers, the Duke COVID hotline number, connecting with Lincoln, connecting with Walgreens testing sites. If anyone has any questions, and also on our DECO website, under the frequently asked questions, it goes a little more in depth on who should be tested when we get calls in, citizens wondering if, what are the reasons that would bring them in and make them concerned and wonder why they should go get tested. And certainly if, citizens are having any kind of symptoms or they know that they've been exposed, those are all reasons for them to be tested. We certainly want to make sure our healthcare workers and first responders and frontline essential workers are getting tested if needed. We do get quite a few calls on what do I do now if I've tested positive? And we have a fantastic surveillance team that anyone in Durham County that tests positive, they do reach out to that client and provide them guidance. Those positive cases will receive a call from our surveillance team daily until they're released from daily monitoring, as well as contact tracing. So that there's a lot of folks working in that surveillance team and making a lot of connections and providing guidance and help to those folks who have tested positive or have come in contact with folks who are and aren't sure what to do next. So we're busy. It's a busy time here at the health department. Does anyone have any questions I can try to help with?
So the health department is not allowing anyone in the building, correct? At this point?
No, that's not true. We do have limited hours, and most of our clinics are open, but have limited hours at this point. And all the clinics that are open and their hours are posted on our website as well. Okay. So we are open, just in a different way.
Okay.
Different hours.
Right. Okay. Thank you. And thank you for sharing that the hours of operation. And if anyone needs
that's this, it. Thank you so much for doing that.
Yeah, and this actually this form can be found on that website, correct?
That's correct.
Okay, all righty. Thank you so much, Jessica. We really appreciate you sharing that.
Thank you.
Does anyone have any questions? Does anyone have any questions for her? And if you do, if you can put it in the chat, that would be great. Okay, that's all. We will move on to our next guest presenter, which is Lee Little from Department of Social Services. Are you there?
Yes.
Okay.
I was just taking it off of mute and everything. Good morning, everyone. It's definitely a pleasure to be here to share some information. I hope all is well and everybody is safe. Wanted to start with, my name is Lee Little. I am the program manager for Aging and Adult Services, which is located on the second floor of the 414 East Main Street Human Services Building. At Adult Services, we host a variety of programs. I won't go into the specifics of the program, but I'll try to overview some of the programs that may help some of the residents and community of Durham County. Our first program would be guardianship program. We actually run a guardianship program for those individuals that the court has deemed incompetent, and thus they need a guardian to perform and help them with managing their their lives. We also have adult protective services program, which is a mandated service. We have about 8 social workers that actually go out and do assessments for reports that we get of neglect, exploitation, and abuse um, for individuals. And I'll get, at the end of it, I'll share all the numbers that you may need for these programs. We also have in-home aid service, um, and that is run by Tammy Tate. She is the supervisor for that program. They actually provide in-home aid and Meals on Wheels for residents um, in Durham County. We have a lot of programs, but we also have crisis services program where we have individuals that actually need help with any kind of financial assistance, being with their rent, with also utilities, medication, to help with medication, and their water bills. So, um, and we have another program called Entry Point and Centralized Intake. That is a program that helps with the homeless population and the entry point to actually get involved into getting a room or getting a stay at the homeless shelter. And all those programs are kind of managed through centralized intake, where we actually have one designated number where people can call and get information about those programs. That number is 919-560-8600. I think someone asked a question, but we continue to, with this pandemic that we're going through, we're continue to change and kind of evolve the way we do services. Currently, right now, we're not seeing, for a lot of our crisis services, we're not seeing anyone face to face, but you are able to get help through uh, telephone contact with our social workers. You will call 919-560-8000. They will then, if you need help with utilities or rental assistance, they will then schedule an appointment so that you can speak to a social worker, and then the social worker can continue to do your assessment and see if what particular program that you would qualify for.
Lee, there was a question. Can you speak to the EBT cards and how they will be delivered and who qualifies?
That is currently not my wheelhouse, but the EBT cards, way how that is, you can do an application for the EBT cards by coming to 414 East Main Street and filling out an application. You could drop off the application or drop the application off. There is a mailbox, it's really a county mailbox that you can drop off any information, and it'll go directly to the social worker, since we are not directly seeing clients face to face. The EBT cards, I can't really speak to the specifics about that, but I can definitely get the information to whoever would like it. And wanted to speak to more of the services that will help some of the individuals that's going through some of the pandemic issues of not being unemployed, and a lot of our crisis services. I think that is a service that we definitely, and in this time, a lot of our clients and a lot of the community will definitely need. Crisis services is definitely available. They're taking appointments. They're trying to make it easier and easier for people to schedule appointments and actually speak with a social worker directly so they can get all the information they need to help with that. For our seniors, I did get that question. For our seniors, we do have adult protective services that actually will assist with assessments. If we get a report, we do actually have a program with Meals on Wheels and actually Meals on Wheels and in-home aid services. Those supervisors are continuing to have their social workers do well checks with anybody that we have a current caseload with. We're not providing well checks for seniors that do not have a caseload with adult and aging services. I want to make sure I caught all the questions.
Yeah, the final question is, can you share the main DSS number just one more time for folks?
The main DSS number is 919-560-8000.
Thank you.
And then the aging and adult services number that will patch you through to any of these additional services regarding adults and aging population will be 919-560-8600. I did want to quickly speak, and I can definitely answer any questions. We do have an eviction diversion program and an opening doors program that's been in existence for about 4 years, where it's helping people with current evictions. That phone number for that is 919-560-8655. It's a collaboration with DSS and legal aid, and it's providing assistance and legal aid to for people that's facing eviction at this current time. A flyer does go out, just for your information, a flyer does go out when a landlord files for eviction, and with this brochure about legal aid and DSS. So this information is automatically given out to the residents. But anytime that they would need that information, they can call, 919-560-8000 and ask to speak to someone regarding their rent if they're facing eviction. Is that all the questions? I'll be happy to answer any additional questions.
Yeah, I think that's all we have right now. But if you have additional questions as we go on, just leave them in the chat and we will answer them again at the end. So thank you, Mr. Little.
Mm-hmm.
Thank you, Mr. Little. I appreciate your time. And don't forget to ask him any questions you might have in the chat. So much information that I think folks are really searching for. So we really appreciate you doing that. And stick around just in case somebody has more questions. Okay. We're going to move on to Ms. Beatrice Laney, who is from Durham Public Schools. And I got the questions if nobody else does.
Good morning. I'm actually going to start by answering a question. Well, not answering, but responding to what is perhaps a question. And that is, no, we don't yet have all the plans for reentry. But there are a team of people who are working on that. And I'm sure that's, paramount on most people's mind, particularly if you have schools who have students who attend Durham Public Schools. So nope, I don't have any, but what you can do is go to Durham Public Schools website, and there's a link called Ignite, And there you can find the most updated information as it relates to COVID-19, as well as the services that are provided to families and students. For example, that's where you can find information about where families can find meals, information about mental health. So it's a great resource, so people can check that out. But I'm sorry, I don't have an answer to what I know is the most burning question that people have. But what? Yeah, was that the question, Denise?
And actually, that wasn't. That was. Thank you for that information.
Okay.
The question I wanted to ask is about the summer. I know that the Durham Public School offers summer, like intercession camps and meals, and that people normally would come and pick up, and buddy packs. I think there's backpack meals, and so I'm wondering what is that going to look like for families?
Yeah, I think that they're going to keep the meal process that they currently have underway in place. Again, go to the website and you can find information about where families can receive food that they need. And right now, they're at certain locations, so you do need to visit the site. It's not like at every school, so families will know where to go.
And I do believe we have a schedule we found, and we'll post it just to make sure it's correct, but of sites that folks can go and pick up food. And with that being said, you also are delivering. There it is.
Yes.
But that's the pantry one. We have a school schedule. Try the other one, Brandon. It's a DPS.
We'll share it at the end.
Okay, we'll get it. Yeah.
And while we're looking at that food schedule, one of the things that's also important, I'm sure Deborah's going to talk about this when she speaks, because you can find most of this information in Network of Care, but there are a number of community organizations, including churches, who also have food banks that families can access as well. Okay, so a little bit about what I can talk to or speak to immediately are some of the things that we are doing at Durham Public Schools to support families, teachers, and students. As you know, students can attend class virtually right now. Some of the challenges have been with some students, of course, not coming to class. I don't want to call them truant, but that's essentially how folks refer to them. So we are missing some kids. We know that's the case, and we'll continue to work on getting those kids into the classroom. But we're also having the same challenges with mental health. Durham Public Schools has an agreement with 6 mental health agencies that we selected via RFP process and interviewing to make those selections in terms of the providers that will serve students in our schools. So each of those providers are assigned a specific number of schools, and they serve those schools and those schools only. So you can't have a kid, for example, who wanted to see an agency that's not assigned to their school. They would need to see their therapist in the office. When we closed to come out for COVID-19, we had about 1,600 students who had been referred and who were receiving co-located mental health services. Since the school has closed, those numbers, of course, have dropped in 2 ways. One, some families are choosing not to continue with their mental health services virtually. Telehealth is something that all our providers can do. It's difficult even finding some of those students. It's easier, and it's one of the beauties of co-located mental health, is that kids pretty much come to school so they can get the services that they need. But if they're not in school, that makes it a whole lot more challenging for them as well. So those are the things that we're seeing in terms of being able to provide mental health for our students. The referrals are also down, but what we did do was change our process a little bit to make it easier for parents to assess mental health. The way it usually works is that a referral has to come in through school, and then find its way to the provider. Anybody can make a referral. We get referrals from pediatricians, we get referrals from parents themselves, and so anyone can make, students self-refer. So folks can make those referrals, but those referrals usually trickle through the school and then out to the provider. What we did during this period of time is to change that a bit so parents can contact the providers that are assigned to their schools directly, and then those providers send that information to the school. So we're just trying to take out what might be a barrier for access to mental health for Durham Public Schools students. So that's co-located mental health. In addition to that, some of the things that we have done is we have offered training. We've had these sets of training called trauma and COVID-19. We have had those trainings for our teachers. We have had them for parents, our administrators, and all of our student services support staff. We will be offering some additional parent trainings in early June. Sorry, I don't have the dates right now. I had hoped to have those before speaking to you all today, but I'll make sure I forward that so that Ashley can have it and distribute it to individuals. We will have those trainings in both English and Spanish. So those parents who cannot speak English can also have access to that trauma COVID-19 training. So that's we've been really working really hard on that. We've had some good attendance, and we're looking forward to offering the parent training a second time. The other training that we'll be offering a second time as well is training for teachers on trauma COVID. They're like, we need to do this again because there were number of teachers who could not get on. So also we'll share those resources for you all so you can distribute it to anybody who you think might be interested in attending those workshops. And they are facilitated by a woman named Robin, whose last name is eluding me at the moment, but it'll probably come to me as I continue to speak. But she has done trauma work all over the country, and not just this country, but all over the world. So we're really lucky to have her to be able to do this training for us. And any of you who want to, feel free to pop in and hear what's being said. So those are our processes that we are currently working on. We do have some other mental health initiatives happening right now. One is called Trauma Leadership Teams. We have 16 teams in our schools who are being trained in trauma sensitivity, and we are partnering with the Center for Child and Family Health to make that happen. Have about 89 staff who are participating, and we're hoping that we can continue that work in the fall. In addition to that, we have currently 8 teams who have been trained, 1 team that's already trained to deliver structured psychotherapy for adolescents responding to chronic health. And that is been doing virtually, the training is, and of course we don't know what it's going to look like because we don't know what school's going to look like when we come back, but at least staff are ready to assist students with those particular initiatives. In addition, with Durham Public Schools, we do have what we call a SCIRT team. Those are our crisis teams who will help schools to address crisis, particularly as it relates to mental health or social emotional needs. It's a little bit different from the emergency sort of crisis, but it is a team. For example, if you lose a student, either through death or accident, or a student who actually, there was death by suicide. We've had one of those already since COVID before COVID came upon us. And we've had 2 students who've been in accidents. So those teams are usually brought together to support the mental health needs of the schools. And we have done some of that via Zoom, for example, with Northern, who lost a student not too long ago. So those are our basic, there's a ton more, but I could go on forever talking about our mental health and social emotional learning activities, programs, and services. But I think those are the ones that are most applicable to the people who are on this call. So I'll take any questions if folks have those. And
I have a question. I want to give you a scenario of a person that I spoke with not too long ago.
okay.
And you you touched on it. You answered part of the question, but the scenario is a woman told me that she works at a school. She's a teacher,
Mhm.
And she says and I'm not sure if it's a school that has mental health services in
All
that.
schools do.
All school, okay, all
Mhm.
right. So she said there are young people that she's connecting with. As a teacher, they still have to check in and make sure students and
Mhm.
parents that she was really worried about.
Mhm.
Now that the student is at home, she was worried about it when they were in school, but she's really worried about the student because she's not real sure that they are safe.
Mhm.
So of course I give them our phone number because that's what I do, but and make sure that they can get connected if necessary. But I want to make sure I understand if that comes up again. The simplest way is to tell that parent, that teacher, to tell the parent to connect to Durham Public Schools mental health resources via the website. Make a referral. Someone
Teacher
will.
can make the referral.
Okay, teacher can make the referral,
She can make the referral.
and that agency that's working with that school are supposed to connect to that parent as soon as possible.
Well,
That's my understanding.
right.
Okay.
Yeah. The teacher can make the referral. Helpful if she talk with the parent about whether or not she's interested in that service. And then the teacher can submit that referral. One of the other things that we are sort of a bit more lenient with is that parents usually have to sign that form.
Mm-hmm.
They can't sign it. We're asking them to text or email their permission to continue
Okay, right.
for referrals, because
Right.
it's hard to get that signature right now. So that's not an obstacle. But if the parent is interested, just have the teacher to make the referral. The teacher submit it to their school point person, who is usually the social worker or the counselor.
Right.
Those are the folks who usually manage the referral through the process. And if she has any concern about the safety of a student, she's obligated to report that, just like, right? So, but any questions she can direct to her student services support staff. And it depends on the schools. For some schools, it's the social worker, and for some schools, it's the counselor who's the mental health point person.
Okay. All right. Thank you so much. I want to.
We have just a couple questions that are related that I want to address before we move on. So there's been a couple questions regarding technology and access for families. One, how is DPS addressing that? And two, do you think that's accounting for some of the students missing classes?
Well, I don't have the data, so I really can't answer that specifically. But I will say that at the onset, the Durham Public Schools did a great deal of work to try to get computers into students' home. We exhausted the supply from Camden Institute. We also know that Spectrum has been a big help in terms of allowing students to sign up for free internet access. One of the things that we do know is that in some families where there's one phone, right, or one computer, it is particularly challenging for those students, particularly if the adult has to go to work and takes the phone with them, then the student doesn't have access to that. But in terms of what those statistics look like, I really can't say, but I'm sure that it has been a barrier to a number of students. However, some teachers do report, as well as a mental health therapist, that they have made arrangements for that. Students will sign on, leave in the middle of the session, not come back, leave in the middle of the classroom, not come back. So there's some of that anecdotal information out there as well. So I would say that, yes, it's probably going to be a challenge for some students.
Thank you.
That was my question. Can I just elaborate a little bit on that? And if you could direct me, perhaps as to who I can speak to as it relates to that, because I'm just going to say right now, currently, I have 5 families who I'm working with, and their children have not been connected to school since they left school for a number of different reasons. And so for me, I see it as a huge barrier as it relates to, the education of our children right now, and it's quite concerning. And again, that's just 5. There are many more. So I just wanted to know I'm sure it's being worked on in some way, but you hear all of these great things that are happening in the education system, you know, children in Zoom classes with their teachers. And I have families who said, well, I haven't heard from anyone from the school. They've reached out. But again, there are a number of different reasons. How should one go about addressing that with families right now?
Okay. I can't see everybody. So who's speaking to me?
I apologize. That I'm Kamu Mimi. I'm the partner coordinator with Alliance.
Okay, great.
And my hair doesn't look too good, so I'm on black.
Oh, okay.
Yours.
That's fine. Yeah, you know, I'm sure that's happening. The first thing that anyone who's working with parents and you hear that story, contact the school. Those numbers still work. People still get the messages. You should communicate directly with the principal. Let them know what the parent has articulated and that they have challenges reaching teachers or whatever those needs are. That's the first step. So if that hasn't, if that's happened and they're still having challenges, of course, you know, Durham Public Schools has a process. You know, you can talk with those folks in our district office if you continue to have challenges. But the first thing to do is to start there. And I'm gonna tell you, a great resource, as most of you who are probably one of these know, are our social workers, right? So communicate with those schools directly. And I do know from my standpoint of view that we have had a lot of parents that we have attempted to reach and have not been able to do so. Either phone numbers were changed, and because we're living in this COVID time, it's not been as easy to get the new numbers from parents. So please encourage any parent that you're communicating with to contact their principal. If it's anything related to mental health, you can certainly email me directly, beatrice.laney@dpsnc.net. Or if you're having problems get through, email me and I'll try to help you figure out how to negotiate, to navigate that.
Thank you.
Yeah, because those students should be in school and, you know, getting further and further behind. And I do hear about that occasionally with parents that have made attempts and have had some challenges doing so.
Absolutely. And the lack of that technology is also causing a barrier in terms of linking some of our family and our youth to the mental health services at the same time. So I'm finding myself, you know, working with families in the sense of not just trying to secure their remote learning, but also to deal with some of the telehealth things as well.
Right,
So
exactly.
both things are missing, you know. Both things.
Yeah, for many of our families, they probably are. As I said, we have parents who have access to technology. It's sometimes shared by multiple people. So that even makes it challenging, even when they have some sort of resources. So you're absolutely right. I know that we continue to look for resources so that parents can have computers in their home. If there's anybody on the call who's aware of computers or electronics devices such as phones or iPads that can be distributed to students, please let us know. Folks will be happy to get those to them. And hopefully Spectrum will continue to be generous and allow students to have an account so they can access the internet. That's been extremely helpful. Other questions? Wow, well, thank you.
Go ahead.
Well, thank you all so much. I appreciate it. And as I said, you can email me with any questions, particularly as they relate to mental health. But if you do have barriers trying to assess other people as well, just shoot me an email and I'll see how I can help you out.
Thank you, Ms. Laney. I really appreciate you. You gave us a lot of information, very helpful information. I appreciate you joining us today and sharing that information. And remember to go to the website if you have any additional questions. Durham Public Schools website, there's a link called Ignite. You can click on that link and get more information if you have questions. And always, you know, shoot Ashley Mitchell Bass. She couldn't be with us today. I think it's the other way around, Ashley Bass Mitchell, email if you want to get in touch with Ms. Laney as well. So thank you so much. We're going to move on to our resource person here at Alliance Health. She is the keeper of the Durham Network of Care. So she manages that website, and she's going to share with us now, and then that's Deborah Duncan.
Good morning. All right, Deneen, you got to turn your volume down or we're going to go. Yeah, we're sitting next to each other and echoing pretty badly back and forth. So as Deneen said, my name is Deborah Duncan and I am the community liaison here at Alliance. I am also the administrator for the Durham Network of Care, and the Durham Network of Care is a collaborative project between the county. Oh, thanks, Brandon. Now I don't have to stare at myself. Between the county and Alliance. And for those of you who haven't been in all of this for 15, 17 years, about that long ago, Durham realized that we were very siloed with each of our county agencies working independently, and there was not a system for collaboration. And they decided to become a one system or a system of care. And as you know, the state has also started that. Every county, every MCO now has a system of care, and every county has a system of care coordinator, which is our Ashley Bass Mitchell, who is a wonderful coordinator of lots of different balls in the air, so to speak. And so part of the system of care, they realized that people were still using paper resources. And if you have a paper resource, you know that the minute it's printed, it's probably out of date. And they decided that the best way to help with that was to create something online. And so after a lot of research and figuring out what was the best one, we went with a company out of California about 15 years ago. That company is Trilogy. And we are one of three, I think it's only three right now, maybe four, in the state of North Carolina that have an online resource guide. One of them is also one of our counties. Wake County has one. And then we have, I believe Mecklenburg has one, and I know Cabarrus County has one. And Durham and Wake decided that instead of doing independent, one for public health, one for mental health, one for whatever, they would do a combined network of care. And so following the system of care philosophy, everything would fall under this one umbrella of our network of care. And so Brandon has very kindly put that website up there on your screens. And it is basically durhamnetworkofcare.org. If you put that in, it will pop right up, and you'll be able to see all the different wonderful resources and products of the company. You'll see that at the very top of our screen here, you can change the languages. I'm not going to do that today because I always struggle getting it back to English. But you can change. I quit counting at 120 languages, folks. So is it linked to NC 360? Not yet. That is the plan, that we will share our resources with them. But my understanding is with the 360 is that it is going to be a provider access and not so much a community member access. So while the hospitals, public health, probably us, our doctor's offices, if they sign on, will have access to 360, your neighbor wouldn't necessarily have access to 360. And Network of Care is truly accessible to any and everybody in our community. And if you live out of state, out of town, but yet you have a family member here who needs resources, you can get on Network of Care and help them navigate and find a resource here. So, but again, there's dialect, you can change languages. Like I said, there's over 120 languages. I got lazy after 120 and said that's a plenty to know about. We're on our home screen, and forgive me, but this moves a little slow because I'm driving Brandon's computer, and we'll all know that Deborah's probably the most technology challenged in the room or online here. So with our home page, you actually typically have, let me see if I can get, somehow we went straight to our services page. Typically, oh, here we go. It's going to switch for us. You'll have our banner right here at the top. And that banner gets changed on a monthly basis. I try to pick things that are hot topics at different organizations. I send out emails middle of every month to dozens of organizations going, you know, do you have anything you'd like to be on the banner this month? I recently had the kindergarten enrollment, the pre-K enrollment back in October, November, and back in kindergarten I had February, March. This month is Children's Mental Health Awareness Month, as you see, and it will just scroll across and give different information about different programs that have been chosen. Here's your Hope for NC flyer. We will continue to keep that as part of our banner so that folks have that resource at hand. That is something that the state and Alliance are providing 24/7 crisis counseling at no charge. And some of our counselors, our system of care coordinator, all of them are helping answer those hotlines, trying to help folks deal with this lovely pandemic that we're in the middle of. I don't know about the rest of you, but my four walls are starting to get a little tight. And as you see, there's lots of different programs we've chosen. We try to get something that's a little bit interesting to all ages and all brackets. So we've got mental health, we've got physical health, we've got seniors, and then we just have fun. Museum of Life and Science, obviously they're closed, but they're doing a lot of online programming. And so those are the 5 topics we've got right now. So then when you scroll further down, you will see that you can actually access all the services that the Network of Care has on there. Let's see, what is utilization like these days? We're having approximately 900 to 1,000 hits. It's waxing and waning. It kind of depends on what's going on. Right now, it's up because of all that's going on, and folks are panicking, looking for food, looking for housing resources. I will tell you, at November, December, it goes way down, and then come January, it climbs again. It really waxes and wanes. But right now, we're at about 900 to 1,000 hits on a daily basis. So, see if there's any other questions. Okay. So again, this is our services. You can actually look for the different services. You can view the categories, and I'll actually touch on that again in a few minutes when I get a little deeper in. I just want to show you the home screen and let you understand what's on that first. We also have community announcements, and this is one of those sections that if your agency has any kind of flyer they want to get out to the community, please send it to me. It takes me about 24 to 48 hours to get it up because I have to submit it and then they pull it live for me. Now, but I will say our hosting company is being very quick right now, knowing that all the different barriers that folks are hitting, they are trying to get things done very quickly. They are working extra hours. I can tell you our person is putting in long hours. And you will see that one of the things that we've been talking about a lot today is food resources. We have the food pantries list here. I'm trying to find it in English. Here is the actual pantries calendar, and then the pantries directory in English. And then we have it in Spanish. And so there's the pantries, and then there is the other page. And forgive me, my Spanish is very bad. So again, these are all the different programs that we receive different flyers for, things that I find out about that I pull together and make a flyer for. When they get out of date, I pull them after they've been up here for a long time. I will pull them and put them back if something comes up about them. So again, if you have any kind of flyer for your agency, any kind of program, anything that you want put up, please let me know and send it to me, and I will get it put up on the Network of Care. We also have the Durham COVID Community Resource Guide. We created a very select, limited guide specifically for resources that have been created due to this pandemic. If our bus situation makes a change, we actually try to get that posted as soon as they tell us. I'm not sure it's going to go to it. We've put up Durham Public Schools information and internet access, like DeBee was speaking about Charter and Spectrum. We put the information on how to access them, talk to them about getting things going. Our mental health resources, physical health services, etc. And you can see the different ones that we have here. Excuse me. And oh, here we go. The bus situation, what it does is it actually will post the information you click down here at the bottom. So like if I click the resources, you'll get that one. Parenting, education resources, we made a very brief list. There are more lists. If you reach out to me, I've actually started creating lists on different online resources, pulling those together and having those available if parents need something. They're looking for things for the summer for their children to do while school is out. And I know that lots of summer camps are canceling, are staying closed due to all of this. So just let me know. We can find things for them as best we can. Bull City Fit is another great one. They're doing everything online, and you can access them through their Facebook page. We are having, well, we have listed here the Durham events, which is basically things like the farmers market and the, let me click it. The Visitors Bureau, the activities that they post. Now, granted, the Visitors Bureau is closed, but the farmers market has just opened, and it takes you straight to their website and gives you their different guidelines. Then we have also got the Wellness Recovery Action Plan, and this is a WRAP plan. Now, this does not take the place of going somewhere and having someone do a WRAP plan with you that is fully trained, but this is a great way to do a WRAP plan at home, especially right now. Thank you, Denise. You can actually follow through with this, and at the end there is actually a worksheet that you can complete. What I look like when I'm well, what I look like when I'm not well, and what I want you to do for me under those circumstances, and emergency contacts. These have been great I've seen them hung on folks' refrigerators. Even if it's just the very back sheet that's the contact list. It's a great resource to have available. So it's a set of videos, and you watch the videos and then do everything that at the end. Then you have a GeoMap program, and basically that's going to pull it. You can actually code map it, and it will pinpoint maps of the places that we have. You will see here, it's a resource map as it loads here. There we go. And you can pick a topic and it'll pinpoint it. And then if you click on one of the pinpoints, it will give you their information, which is a wonderful resource to have. And then we've also decided that instead of uploading or downloading, I guess, all the other different databases that we have come across, we've actually put links because it could overwhelm folks, excuse me, to find this much information on one web page. So there's a link for just our mental health providers that Alliance has under our MCO belt. The Carolina Parent Resource Guide, Juvenile Justice has its own service directory. The LGBTQ Center has a resource guide, and that is a plethora of things in Durham that not only are friendly to the LGBTQ community, will hire the LGBTQ community. It's just a great resource, but it also has social resources, and that is very specific to them. To that resource guide. I don't know of another resource guide that has social resources. Things like nightclubs and events like that. The Medicaid dentist, the Medicaid docs, and then here's a second resource guide, much like that, those two. We have a summer camp directory that we are trying, that's the one out of UNC. And they are offering some summer camps. They are offering some virtual camps. So it's kind of hit or miss at this point as to what you're going to find for summer camp. And I apologize for that. There's just nothing we can do at this point. And then we have the Wake Network of Care. And if you live on the border of Durham and Wake counties, you will probably access things that are not paid for by your insurance. Most things that are paid for by your insurance might try to make you be more county specific. But a lot of the Wake Network of Care things you can access even if you don't live in that county. And then we also have care guides. And your care guide, you can specifically see if it will pull mine up. I have created one. And nope, it's not going to pull it up this morning. So you can actually create your own care guide. And basically what that means is you are going to find resources that are important to you. And most of you know I have lupus, so we'll just put lupus down here. And so right now we have 8 articles in our library. It's showing the 12 most currently selected medications, and there's a large news article that is about lupus right now, that you can drop into that part of your care guide, and it's at your fingertips all the time, and you don't have to constantly search for it. You can also look for things in the service directory, the keywords. We have 5 minutes. Okay, Deneen, I'm hurrying. And then let me see what else we can do here. My information, contact information is down at the bottom. And then you also have a services button. If you are an agency that needs to update your information, I beg you to please go on there and update your information. If you find you can't update it on your own, please send me your updates. We try to keep everybody on there. I may have missed someone. Somebody may be new and I don't know about it. We would love to add you on there. It is free to be added. It's a great publicity tool for, if you're a new agency or a new company. If you are a member of an organization that does something in the community, that can be listed as well. So please, please add those kinds of things, or let me know if you are interested in having those added. We do have a topic library, and you will see that. Things about our legislature, local, state, and national links, information about insurances, support and advocacy, and you can create your own private health record. If you yourself or your consumers need some kind of card to carry around with information on it, they will print that. It is much like a credit card, and you can get a new one every day, folks. It is free. All you have to do is you go on here, you fill it out, you tell them where to mail it. In about 4 or 5 days, you get a new plastic card. And you can create one for care coordination. You can create one for emergency information, which is a great resource. We gave one to our daughter when she was younger. She carried it around just to have all the emergency numbers that she needed, even though she did have her phone. But we all know phones shouldn't be pulled out in class. You can also upload test results. You can upload IEPs, which is what we did. So our daughter had her IEP at her fingertips, those kinds of things. So that is Durham Network of Care in a nutshell. I can talk and talk and talk a lot about Durham Network of Care. And so if you want more information, let me know. I'll be glad to give us a presentation to your organization. I'll be glad to work with your consumers. Right now, of course, it's going to be virtually. I don't know of anywhere that's open that we can go and sit 6 feet apart, but we could give it a try. And so just let me know. I'm at your disposal. So just give me a call or email me. Email is actually best. So, and I believe Brandon put my email up earlier. So just let me know. Thanks.
Thank you, Deborah. That was great. I appreciate you. No, you did a good job. Appreciate that. A lot of information in that. And I just want to add, though, if you need brochures, Network of Care brochures, Alliance brochures, just email me. I would be more than happy to deliver them onto your doorstep. And I want to add that Brandon is going to pull up the Hope for NC brochure again. And I just want to highlight that because that's an important resource that the citizens of North Carolina can access. That is the crisis counseling service. Alliance is partnering with the state to provide this service free of charge, and it's online crisis help. So you can call this number, and there's a crisis counselors that are available to speak with you during this. And this is for crisis situations that we're in, the pandemic, and it was I think originated during one of the hurricanes that happened in North Carolina, and people were displaced. They didn't know what, they needed help. They needed to speak to someone, and they needed resources. So this is what this is all about. So now that we have COVID-19, there are a lot of people who are dealing with stress and anxiety and depression and not knowing what to do, who to talk to. You can call this number. That's a really important to know. And if you need this flyer so you can pass it out to your agencies and churches or community, agencies or what have you, please let us know. We can email it to you. Also, I think Deborah mentioned the pantries. Also have flyers for that as well. These are days, and this is the directory, and times and days that different agencies are passing out food. So we have access to that. We can get that to you as well. Anything else you might need, feel free to email us. We are available and here to help you all get the information you need. If you, and as I'm community education, so what I do is trainees and community fairs. So if there's a training you're all interested in, mental health, your agency, your church, or what have you, it doesn't matter, interested in any of our trainings, we're doing that virtually. So yay. And if I can't do it, I know somebody who can. I have some colleagues that may be able to help with that. So we can come to you all via Zoom and provide that training. Like Deborah said, she can come to you as well via Zoom to provide additional network of care trainings. So we, if there's no more questions, it's 11:30 and this is supposed to end at 11:30. So we're right on target. Feel free to, Brandon, I don't think there's any more questions. If
there's no more questions,
you
I want to
can
make sure
ask them now really quickly.
there are no more questions, but I want to make sure, folks, if you haven't seen the chat, Amy Armstrong from the HELP program, which is the Health Equipment Loan Program in Durham, left some information about her organization in the chat. So if you don't see that, I encourage you to check it out. It's a program that provides loans of medical equipment to anyone in Durham without regard to income or insurance, and the loans are at no cost. So I would definitely, if you're interested and you haven't seen that in the chat box, it came up earlier on in the chat, but she left that information in there. So please check that out. We'll actually leave the meeting open just for a couple minutes so folks can scroll back through and maybe find that or other links that were put in there, and then we will close the meeting.
Thank you again for coming. Oh, there's one more thing.
I had an announcement too. I'm sorry.
Okay, go ahead. No, go ahead.
No, I just wanted to announce that tomorrow the Durham Community Collaborative will be having a meeting via Zoom from 10 to 11:30, and we are lucky enough to have our Chief Medical Officer, Dr. Mayhew, to join us, and he'll be addressing best practices, sort of steps and cautions as we move through the various phases of reopening during COVID-19. So we just would like to invite anyone who wants to attend. I'm putting it in the information in the chat, so feel free to share and join us as well.
Thank you, Kamu. Okay. If there are no more questions or concerns, Brandon, you have anything else?
Nope, that was it. And like I said, we will leave the chat open just for a couple minutes. I know Mr. Little from Social Services also put a link in there as well. So please take a look because the chat will not save in the recording. So take a look now, and if you have to get it down, we'll leave it open, like I said, just for a few minutes.
Okay. Oh, that was a link to EBT question, right? Yes. Okay, great. And thank you, Kimberly Monroe. I'm glad to see you too. She also put a link. Well, she asked the question as a link to NCK. I think Deborah addressed that. Okay, great.
Yes, that was a link to the EBT question. And if you follow that link, you will be able to get the information about eligibility criteria.
nice music and everything like that.